Well, good evening, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. I love helping bring you reputable resources among my friends who just so happen to be in the healthcare arena. So, tonight I have the honor and pleasure of having two great friends here that are with Cancer Care Services. So, first, I'm going to go off by saying, Carlene and James, thank you for taking the time out of your busy schedules to come and chat
You're
with
welcome.
us and educate the public on the services that you provide. So, we'll start off with Carlene. Carlene, tell us a little bit about yourself and why you do cancer care services, and then we'll go into James, and then we'll go into our health chat.
Okay. Well, I'm Carlene King, and I am a 13-year breast cancer survivor. And I'm also a former client, thank you, former client of Cancer Care Services. So I have been an advocate for Cancer Care Services for about 13 years now. And I've recently become a part of the staff there. So when they asked me if I would consider coming to work for them, of course, it was an easy answer because I have loved this organization and told people about this organization for all of these years. So I am a community health worker and community outreach coordinator now for Cancer Care.
Awesome. Thank you so much for that introduction. James, how about you?
Yeah, no problem. My name is James Earl. I've been an employee of Cancer Care Services for going on 7 years now. I've been impacted on multiple fronts in my family, by cancer, and I am the director of um, outreach and health equity.
Wonderful. So, those are some awesome, amazing titles. So, we want to go into cancer care services. What is the mission? What is the vision of cancer care services? And then, well, let's go into some of the services that you provide. So, James, I'm going to hand it over to you. And
Yeah, so you know, um, the cancer experience can be very confusing. It can be very stressful,
scary.
and it can be a lot for our clients to handle. And so, our mission at Cancer Care Services is to support cancer patients, care for the caregiver, and empower survivors to reduce the impact of cancer in Tarrant County. And so our support, we provide it in all forms to individuals and families of all ages. And really, in terms of support services, we kind of look at it in a number of ways. From a financial perspective, we provide assistance in with the health insurance premiums, medication expenses, and nutritional supplements when needed. And also, we provide free counseling and support for caregivers of all ages. And so that includes children who we consider caregivers as well. And then cancer related bills. That is a huge consideration when you look at the cancer experience. And so we have a financial navigator on staff to provide their expertise in helping our clients negotiate and navigate those medical bills. And so when we look at all of these great services that we provide, they actually come at no cost to our clients.
Wow. I wish I had an audience that could go, yeah, because that's
Yeah.
wonderful because you look at the whole person. It's about not just about a tunnel vision, like we're going to treat your cancer, but it's all about the financial, the mental, the family, the caregivers that are caring for that person.
Mhm.
It is so much, and I'm so honored and grateful that I ran into Carlene and she introduced me to you, and we just got so involved. So, Carlene, tell us a little bit about your experience as a patient with cancer care
Well,
services.
no, when I was first introduced to cancer care, it was while I was doing my chemo treatments. And of course, at that time, and I still am, I'm a real estate broker. So, my income, was fine. I had income. Um, and most of the time, when you think of the social services organizations and the, things that are out here, they really look hard at your income. Well, I didn't think that I would qualify. So I never bothered to follow up, with the social worker that was there. And finally she said, well, you can go and get a massage, and you can have a massage before each one of your treatments. And that has nothing to do with your income. So of course that got my attention real quick. So, but when I went in for my massage, what I found out is that when you first walk into that building there, everybody treats you like they have known you for years. It's like one big happy family over there. And when I walked out, I got my massage, but by the time I left, they were offering to pay for my insurance premiums. They had given me money for any medications that I might need that month. And, from then I was just, I was hooked. So I ran into so many people that were, deciding, do I, pay my car note, or do I buy medication? Do I eat, or do I, and it was really sad because I would always ask, have you ever heard of Cancer Care Services? They were like, no, I haven't. And so there's so many people in our communities that just have no clue of the resources that are out there. And the other part that I love about this organization is that where a lot of people will really grill you on your income and your ability, Cancer Care will find ways to help you regardless of what your income is. So I always tell people, just call. You don't have to know what you want. Don't worry about what your income is. Let them figure all of that out, because I guarantee you, they'll find some kind of way to help you with something.
Oh, that's wonderful, because that's hope. That whole thing said hope to me.
Right, right.
Because when you're diagnosed, when you get a detrimental diagnosis such as cancer, you're like, what am I going to do? Where do
Yeah.
I turn?
Yeah,
Who
yeah.
do I call?
Mhm.
I have no
And if you don't have,
support.
if you don't have that stress on you of worrying about how am I going to pay for anything, that allows you to just focus on getting well.
Yeah,
Yes,
and
yes.
to your point, Deidre, that kind of really speaks to the importance of what Carlene does in the community. Um,
Hmm.
she is a 13-year cancer survivor. She understands the experience, and so when she's going out into our Black and Brown communities and touching lives, they have a familiar face that they can turn to, that will help navigate and get them connected with our social workers and with our agency, to walk that difficult journey with them.
And that is so wonderful. So now that we're talking about our Black and Brown community, the healthcare disparities that are throughout, from COVID to hypertension to cancer to whatever you want to call it, is all about us being supporters and encouragers and resource providers and finders for those people who need that help. That it is help out there, that there are people who want to help you. And it's just all about picking up the phone and finding out about those resources. So, speaking of finding out about those resources, what are some of the things that you have done with Cancer Care Services that spreads the word about what Cancer Services is and what services they provide?
Carlene, you wanna touch on that?
Yes.
Well, the main thing that we do to try to reach our communities, what I found is that it's so much more effective if we are like boots on the ground and we really get in there, get to know the people in the community, talk to the people in the community. We also partner with different, agencies, community leaders, and then I just say people that just like to talk, because they're the ones, everybody's going to, in one way or another, be affected by cancer, or they know somebody that's been affected. Like I tell them, you may not know anybody right now, but I guarantee you at some point, you'll need to say, hey, you know what, call Cancer Care. And that's all that we need people to do, is just, know enough to say, these people will help you. So the main thing that I found that it works better than anything else is, like James said, being out in the community, and, I understand where they are and where they're going, kind of. And so it gives them a level of comfort and trust.
Mhm.
And then, like I said, once they walk through the doors or they talk to somebody from cancer care, from there it's just sealed. They know that they've got a friend. They know that they've got people that truly are concerned about their well-being.
Yeah, and the relationships that we establish from agencies and entities that may make referrals to us, we leverage those to bring them on our outreach tours. And our outreach tours are about 30 to 40 minutes long. And we look at the services, and actually we provide context of the services that Cancer Care Services provides from a health equity disparities lens, to really kind of drive home the point of, we need to raise our profile in our Black and Brown communities to provide them with the knowledge and the navigation, and tap into the power that they already have to be strong advocates, during their cancer journey.
Wonderful. So, what are some of the ways you have tried to pivot during COVID? So, what are some of the things that you've
Yeah,
implemented?
well, as an agency wide,
Mhm.
we have actually been working remotely since March 17th exactly. And so we have limited office hours where we have a social worker on site that can still service our clients and provide them with the service that they need. But typically, when we're contacted, calls are triaged, to our receptionist, which then she kind of doles out those calls to our social work staff. From a programmatic standpoint, we've had to transition into the virtual space.
Yeah.
And so some of our activities and social activities that we've had for clients have been virtual, as well as our counseling program. Counseling program has been virtual as well as by phone. And um, kind of like the outreach that we're doing today with
Right.
Carlene and I. We've had to undergo similar transitions, and we've been meeting with people, calling, emails, trying to operate virtually, and making and being measured when we do go out in the community, to be safe, to observe all protocols,
Yeah.
in terms of COVID precautions. So yeah, it's been a difficult transition, but I think that speaks to um, the resiliency of our agency. We're
Absolutely.
resilient, and so we kind of pass that along to our clients as well. It's a resilient journey together.
I love that because COVID didn't stop you,
Exactly.
and actually, in a way, it helped enhance your audience because you can
Hmm.
reach more people, right?
Right.
Because I found that virtually, at first I was fighting it too at the beginning of COVID, and it's like, oh, I don't want to do virtual, da, 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 da. But it's expanded the a broader audience. So
Yeah,
that's
our
so good.
our CEO Melanie Wilson, she made a great point when we were transitioning. She says, cancer can't stop. Cancer doesn't stop, so
Right,
neither can we.
right,
And
right.
so we had to find a way to adapt, to continue to serve. And as a matter of fact, um, compared to 20 looking at 2020
Mhm.
compared to 2019, I
Mhm.
think we served, don't quote me on this, but I think we served just about 500 less clients than we did in 2020 than we did in 2019. So there wasn't much of a drop
Right,
off
right.
in our effectiveness in being able to reach clients over the long
That's wonderful. But I want people to know too that don't think COVID can stop you from picking up the phone
haul. Hmm.
and contacting cancer care services. If you know
Right.
somebody, trust somebody, like somebody, hate somebody, and they have cancer, or you're affected by someone, or you're caring for someone who has cancer, or you
Mhm.
know someone who's just newly diagnosed, they can call you guys, right?
Right.
Absolutely, absolutely.
That's what it's all about. So, what are some of the other things that you implement to make the public more aware of your presence?
Um, well, one of the things, of course, social media is a very important part of what we do. We have a vibrant social media following, and we're always delivering great content that is relevant to the times that we're in. We reach the community with our newsletter as well. And Carlene and I are plugged in into a number of community groups with an emphasis on health disparities and health equity. And so that is really just kind of a few ways that we've kind of been able to continue to get the message out about cancer care services. And then also we're always open for any speaking engagements and opportunities that can raise awareness about who we are and what we do.
Now, the newsletter, how can someone sign up for that newsletter?
Yeah, actually, the newsletter can be accessed from our website. It's www.cancercareservices.org.
Awesome. And you have a Facebook page also,
Mm-hmm. Cancer Care Services.
Cancer Care Services. So I noticed that there's a lot of information on there that people can benefit from.
Mhm.
And I love that. I love the newsletter. I love the Facebook page. I love the programming that you guys are doing. We just want to be able to help you guys spread the word about these amazing services. So, Carlene, um, wanted to ask you another question, um, and it may be for James as well. What is your vision for 2021 and cancer care services?
I made this comment to James the other day. I said, okay, I said, we're back. 2020 is behind us. We already know COVID is, here,
Oh, wow.
but I'm determined to, go into stealth mode this year because, we think about, James mentioned that we were only like 500 clients, short of 2019.
Mhm.
Also have to remember that there were probably a lot of people who have put their cancer treatments on hold, who
Oh,
bothered
yes.
to go and get any
Mhm.
kind of screenings done. So
Mhm.
we really, really want to emphasize the screenings this year
Right,
um, more than ever, to try to get people back on track. Um,
right.
just to get themselves checked out and let's take care
Absolutely.
of. So I think my goal for this year, like I told James, I said, the one question that I don't want to hear again is that people have never heard of cancer care services.
Right.
So that's my goal for this year to try to reduce that.
Yes.
Yeah, you know, guess one of our my goals is to reinvigorate our Cancer Disparities Coalition and bring together you know different community partners, community members who have an interest in reducing um, disparities, as it relates to cancer. And so, that's going to require us really, really getting out in front of people and trying to make as many connections as possible. And so that's one of the things that I want to accomplish in 2021, the vision I have for cancer.
Wonderful goals, wonderful vision. So let's again go back and repeat how someone can get in touch with Cancer Care Services. And you're located right here in Fort Worth, but since COVID, of course, there's limited or no office hours. But
Yeah, absolutely. There are a number of entry points. For our community members and the zip codes that we're serving, typically underserved communities.
right,
Carlene is in those a lot and makes a lot of contact. So she can be reached at Carlene at cancercareservices.org. Also, we have a hotline that we can be reached at, which is 817 921 0653. And any inquiries or referrals also can be made through our email, which is info@cancercareservices.org.
.org.
.org.
Yes, I lost
Yes.
this. Okay, awesome. Well, this has been so enlightening. Do you guys have any closing comments?
I think the one thing that I want to say in closing is for anybody that's out there that would like to partner with us to help get this word out, any organization, any person, please, reach out to us, give us a call, and we would love to work with anyone, that's out in our communities.
Absolutely. Absolutely.
I would like to echo Carlene's sentiments and add to our clients that we serve, or any potential clients, that you're not alone. Um, we are going to be here every step of the way for you, and we are ready and willing to serve.
And again, cancercareservices.org.
Yes, careservices.org.
Please don't hesitate to reach out, reach out, reach out to cancercareservices.org. I'm so happy to be affiliated with this organization as a resource, and it's been an honor and just so much fun talking to you guys tonight. So, thank you again, and thank you everyone for tuning in to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse, educator, advocator, and navigator, and we love helping you find reputable resources. Tune in next time for another amazing chat with another amazing resource. Thank you again.
Thank you.